For me, it all started in 2011. I'd just come back from an amazing Christmas in Thailand with my family, and the initial pain I felt was when I stepped off the plane.
My daughter Daisy is 12 now, but in October 2014 she was 8 years old and she was diagnosed with Ewing's sarcoma.
In October I lost my younger sister Liberty to Ewing's. She was 14.
I used to get intermittent knee pain.
The primary symptoms of bone cancer are obviously bone pain. The quality of the pain can be intermittent or constant. It's often resistant to painkillers and characteristically can be worse at night.
But I was getting more and more interrupted by the pain in my knee, especially in bed at night. And in the morning when I was going for the college bus, I'd have to ask people if I could sit down.
Daisy experienced leg pain, intermittent and very random. And it went on for a period of about 8 to 12 weeks.
Before she was diagnosed, she just had pain in her shins all the time. She'd feel really sick and wake up at night crying, saying she was in pain.
Tiredness, a very common symptom that we see in primary care. Sweats, and particularly night sweats and fever, likewise. And obviously, again, with all other cancers, weight loss.
I was laid on the sofa and my mum was rubbing my legs and there was a lump on my leg.
I went back to my physio, and this time I think he saw the warning signs. My knee at this point was swollen, it was even more turned in and it felt warm.
My husband looked at her leg and said, "It feels really warm, please will you take her to the GP?"
And very often there's a lump or swelling seen at the site of the pain. The lump can have grown rapidly, and that's a characteristic symptom. And what we tend to look for is a lump that's anything over about 4.5 to 5 centimetres in diameter.
It was put down initially as a sporting injury.
There may be problems with mobility, joint stiffness and reduced movement. There may be a limp. There may be easy bruising. In my view, it's really important for GPs to be aware of the symptoms of bone cancer. Bone cancer, as we know, is exceptionally rare. Probably the opportunity to make a diagnosis would be between 0 and 1 in a career. It would be terrible to miss that opportunity to make an early diagnosis for a patient. To delay the diagnosis and for it to be late will compromise the patient's prognosis. It makes it more likely they'll require an amputation for treatment of their cancer and will adversely affect their survival. So awareness is everything when it comes to making a diagnosis in this situation. The Bone Cancer Research Trust have developed a learning module, an online learning module with the Royal College of General Practitioners that's available for GPs and actually all medical professionals to see. It's full of simple information, the basics that every doctor would need to know about bone cancer, what to look for, how to make a diagnosis, and of course, if you do complete the module, it will contribute to your appraisal and your continual professional development.